Well, welcome everyone to this session of the AI Nurses Network. Today we have a lovely nursing colleague with us, Dr. Mark Doran, who's based at Queen's University Belfast and is going to tell us all about what they're doing with AI in the nursing faculty there.
Perfect. Thank you so much indeed. It's lovely to be with the AI Nurses Network, and I really enjoy all of the things that you share as well, Siobhán. It's really interesting to see all of the great moves and great strides that we have in nursing, and it's a pleasure to be here today just to share about a few of the different things that we have got going on. So we don't have a presentation, so we're very much happy to chat through some of the work that we have been doing. So the first thing maybe I want to mention as well too, so I published a paper just last year and entitled it Every Nurse an AI Nurse. And really that was to set the precipice for us as a department as well, what we are trying to achieve. And within that, there was a suggested framework in around 5 key areas of how we support nurses to become aware that AI is there, how they prepare for it, so things, having these educational courses. And we do know there's a lot of really good information out there, but not often tailored towards nursing, where there's some pockets of really good nursing that you can see, and some others like community nursing maybe doesn't have as much, or nursing home nursing. So how people are prepared for it, how we then start to how we dare with our AI. We get some of these innovations as well too. We step into those leadership roles within our trusts, within our universities, and work towards AI within our own profession. One of the really amazing opportunities that we have at Queen's, and they are very quick off the mark in a lot of these ways in different elements. We have AIQ, which is AI at Queen's, which is a research group or community of interest really, and it brings across lots of different departments together. And initially, the first time I went to this, I had that real sense of being an imposter there, because I was there as a nurse and these guys were all engineers, and they were scientists or mathematicians, and they were all working with models and computing. And it was such, at the end of it, I did not feel like that at all. And that would probably be one of my big encouragement for nurses and midwives and healthcare professionals, is be part of those conversations. They have the technology, but they don't have the real world questions. And that is exactly what they were saying there, is that we know what we can answer, but without you bringing the questions, we're nothing to do with it. And so a really fantastic opportunity, and a massive encouragement to go ahead and be part of those. So that's on the research side, and then on the education side too, for right across the university. There's great strides with our AI hub, so how we tackle things like academic integrity, but also then creativity and using it within curriculum and curriculum design. And I'll share a few examples of how we've been doing that within nursing too, really practical ways.
Great, that sounds good. Yeah, I'd love to know more about the nursing education side, because I think a lot of nurse educators, like we're all so busy anyway. Where do we find the time to do the AI bit and bring it into our curriculum?
Yeah, absolutely. So one of the examples that, well, I'll share two, but one of the first examples that I want to talk about is I lead on the applied pharmacology module for our final year nursing students. So they're right at the end. They have a lot of experience at this point. They've seen a lot. So it's really that application and real world patient experiences. And so one of the ways that we have used generative AI in this context is that we ask students to go away and use generative AI to create a patient scenario. They obviously come with a lot of experience and have all of those patient scenarios within their head or out in practice, and they can use those, because we don't force any student to use it if they don't want to, but a lot of it have done. Previously, we had, I would have said, about 95% came with an AI generated scenario. So for us, instead of saying, no, don't use it, we're saying, okay, use it. However, the big considerations with that is that you own the professional responsibility and the judgment of what it creates. So if it creates a list of medications that you don't quite understand, you need to go and find some reputable sources to be able to signpost the correct dosage or signpost the correct medication by accessing the DNF or something similar. So really we're trying to say, yeah, we're open to this, we're open to it in a creative sense, as long as you're safe, and thoughtful, and that you own your own knowledge at the end of it. We ask them then to bring these to class and share them with each other as well too. So again, this is a little bit more creative than, for example, just me creating all of the scenarios. They will bring hundreds more than I would, and then they go through a patient assessment, mimicking that. The second aspect of that as well too is what we're seeing a lot more is that it's no longer consult Dr. Google, it's consult Dr. ChatGPT.
Yeah.
So patients are really coming with ChatGPT generated information. So what we get students to do is I create a scenario very obviously fabricated by generative AI. They are given that, asked to appraise it, and then they have to determine what's the correct information and not correct information, and benchmark that against some NICE guidelines or NHS guidelines. And then they also have to, in a exercise their advanced communication skills and how they actually redirect or signpost or talk to a person who has brought this about what is right and what is wrong, and how they are going to be able to stand over that. So really for us, that was thinking very clearly about where that professional responsibility lies and the judgment, but still relying on the systematic assessment and evaluation tools that you learn as part of your course.
Do you know, Mark, are they all just using ChatGPT or are they using a range of different Gen AI stuff?
Yeah, it seems to be that ChatGPT is the big one. I would suggest most of them are using that. There are a few would go for Copilot. It is embedded into
That's true. Yeah.
Office, and you would see some of them going there. Maybe a few would mention Gemini as well too, but I think that ChatGPT has quite the monopoly on it
Skills.
for most of the students. Couldn't determine at this stage whether or not we see people having like going and paying for the licenses to get to maybe that next level. Is probably just the free version for it,
Yeah. Yeah, I
and
think
what
that's
they're
fair.
expecting it to do. Probably that suits well for there.
Yeah. Are you starting to use it in simulation education at all or
Yes, no,
yeah.
so absolutely. So I think that's one of the other aspects that we have been looking at too. So I created some AI patients using a third-party platform as well too. So within one of the modules that I work with the registered nurses in respiratory, we created 10 different patients who all had a different respiratory condition, different age, different ethnicity, different problem,
Mm.
and they had to use their advanced consultation skills as specialist practice nurses to be able to assess this patient. So that was much more of a simulation. Um, it was really helpful because in a second way, it was also getting them to improve their remote and distant consultation skills. So how do they assess a patient whenever they can't physically see them in front of them via telephone call, via tele-platform or something like that too. So they really had to rely on what they were asking the patient to go through. These bots were very good and evaluated very well. The big downfall was the Northern Irish accent. It could not grab our accent at times, so it kept asking for clarification on what the nurses were asking, which was fine, but really helped us understand a little bit of the bias, a little bit of the training models in there too. So maybe with a little bit more tailoring and a little bit more training, it could pick up on those. But that was an excellent for me learning lesson in consultation and simulation. We didn't it was easier to make with an interest in AI. It was much easier to make. Students got more rapid access to it than bringing in, for example, actors or getting down to the simulation skills. Equally, they were able to review the transcript afterwards. There is that option built in, so they could actually see, and if they wanted to do a little bit of reflective practice on that, they could see the transcript of what they or themselves were doing. Equally, whilst at that moment in time every student got a different patient across 10 students, they could go in and do it themselves at home. So they could have 10 different interactions. So again, a little bit more building those skills up than just a one-off experience.
Was that something that you developed in-house or did you purchase a commercial platform?
Yeah, so that is so because we're using it in trial at the moment. So it was a commercial platform that then adapted to that. It wasn't initially designed to that for that. I think it was designed for something more like telemarketing or something like
Ah,
this, but did have the capability to be transformed into patients. So yeah, so it just sat outside the infrastructure. But I think that with getting some of those small pilots and small evaluations, we can then have proof to try and get more funding for rolling it out to more people.
Yeah. If someone gave you a load of money tomorrow, what do you think you'd do with it if you could spend it on AI?
Oh, that is a big question. How much money are we talking?
Sky's the limit.
Yeah, I would love, 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 love to see. I would love to make an AI hospital. So from door to door, that you as a simulation could go into the hospital to the AI powered hospital and go in and as a nursing student or postgraduate student, go in to for a side room and at one point be practicing how to talk about breaking bad news. Go into another room where people would be doing a top to assessment or you'd be visualizing a wound care and things like that. So actually, people were getting this real simulation experience, and I think yeah, there is a lot of different elements of education sitting around there. So that's probably where I'd put my money of building an AI hospital for nursing education at the moment. I think the other area would be obviously, and you know so much about this in analytics in nursing data. I think getting we have so much nursing data there that could be really harnessed, but we're just not structured or coded correctly in certain ways. It's more of that data lake rather than the data library within nursing. So a bit more money into getting that structured so then we could actually utilize it for nursing outcomes, patient outcomes, and then being able to target care more strategically.
Yeah, no, that makes sense. Are nurses, are the students when they go out to practice, are they seeing nurses in Northern Ireland use any AI tools in the hospital or community settings yet, or maybe they're in progress?
Yeah, I think there are some little pockets. We certainly will see, not, I would say it's not widespread.
Mm,
And I would say that there is maybe elements of AI working that they don't really see
mm,
or are not familiar that it might be artificial intelligence at this point.
yeah,
There are some things in and around wound care scanning that I have seen before, where actually artificial intelligence can suggest some of the tissue types and prompt people to that. Again, to we're a bit wary on things like that about prompting clinical decisions, so there's a lot of regulation that sits in around that.
yes.
But other than that, it's quite slow, I would say, particularly in nursing. And within Northern Ireland, we did over the last 2 years implement the new electronic health record. So there is a lot of emphasis on that
Mm,
being rolled out. But then that really sets the platform and stage for new data collection, new data analysis, but also the implementation of artificial intelligence within those.
yeah, that's great. It'll be great to see that platform being used, and then once it's embedded,
Mhm.
yeah, you'll really be able to build on it. So I think
Mhm.
it's an exciting time to be a nurse heading out into into practice.
Absolutely, yeah,
Yeah,
yeah, and one of the other ones as well too that we created, and actually maybe this is something that we do see a little bit more in practice. Chatbots,
yeah,
chatbots are so helpful, so useful, and in terms of one of the original questions too was thinking about how it's really helped us as educators. Is I don't think anybody would be sad if we came up with a way of getting rid of the vast amount of emails that we get.
it's true.
So we created a chatbot for evidence-based nursing, so one of our modules, and within that we included pretty much like all of the information that someone would need to successfully get through the assessment and
Great.
module. Um, Really to minimize the amount of emails that you got around routine things, but
Mm,
also then that maximizes the time that you get to spend with students thinking creatively about some quality improvement projects or evidence-based nursing. So if the chatbot can be accessed 24/7, the weekends and the evenings for very routine questions, um, students are getting then a swifter response and they're not relying necessarily on the tutor for that. And we do know as well too, with lots and lots of information given in booklets or in book form, that people really aren't spending the time reading through that. So something that can actually be easily accessed. Similarly, as well too, we have seen a lot of research coming out around that too, and I was looking at a study recently where they did this in primary care with a big chatbot. It's
Oh.
quite. I always think primary care would benefit so much from a chatbot. But it's so spread out the
Mm.
care. But we can see then as well how chatbots are coming into clinical care and clinical use too for another example in sexual health, where people were accessing some of those information, where to get tested, where they need to go, and it was powered by AI, and it was pulling different resources in from different perspectives and being able to read what people had potentially written that wasn't quite right. So I thought that was really interesting. And we're seeing that too, that there is higher usage of chatbots in areas where there is potentially more stigma attached. So mental health stigma, sexual health and well-being stigma, that people want to talk to something that online as opposed to going accessing a real person. So there's real power actually behind some of those as well.
Yeah, I'm hoping the chatbots will get more engaging just by having more kind of audio-based or even video-based
Mm,
chatbots, so it's not constantly text, but they're definitely being used, which is great.
hmm
I was just wondering, do you have any advice for nurses, Mark, about how to learn a bit more about AI and get involved? Because it can be a little bit off-putting, I suppose, if all the jargon around AI and like all the technical people that work in the field, yeah, some nurses might be put off by that.
Absolutely. No, and I think that that's one of the biggest concerns that I hear with both undergraduates are a bit more potentially just from their demographic, they're a bit more native in that
Mm,
area. So they're very much more trial and error, if it works and see what happens. Some of our registered nurses are a little bit more cautious, and I think, rightly so. As a profession, we do need to be
yeah.
cautious. We'll get sold lots of different products or lots of different platforms, and they'll be great, but we need to make sure that they're robustly tested, and especially if they're making any decisions about patient care, we need to make sure that we are involved as part of that.
Mm,
I think, I think we should be embracing it. I really want to see nurses as co-creators rather than end users. I really want to see them right at the start by saying, actually, here are the questions that really want to be answered. And they have so much interaction with patients, and they're the biggest data contributors within health professions too. So nurses are key to that. In terms of accessing information, I totally agree. There's so much out there at the
mm,
moment. It's where do you get started? I often encourage people to maybe download an app and just start interacting with it. So something like ChatGPT or Gemini, and just start seeing what it is. I think if we can get a harness of some uh, considerations around generative AI, first of all, then we are setting that scene for maybe a little bit more down the line of other really interesting aspects of AI. I think that would be helpful. Um, in terms of maybe accessing training, I usually encourage people to go and have a little look at YouTube and some small videos of YouTube. Don't enroll yourself in a course just yet. Go and watch a few videos really from the start. And nurses, as we know, are so practical, and they really want to see how this can actually be practically implemented. So again, throwing some of those things into YouTube can be really helpful to see actually where we are with nursing. And again, too, shameless plug for AI Nurses Network. I think it is absolutely fantastic resource for people who are both interested in the world of AI, but also dipping their toe into. And there's lots of really good papers and resources where people can go and access that.
yeah, thank.
Yeah, and sorry, I was just going to finish that. I think that we're all challenged by that at the moment. I know certainly whenever I go to present or teach something, you have people in the room who have never used AI or have never knowingly used AI, and you have people in the room who are creating, designing, implementing AI. And I think that there's just a huge spectrum across at the moment as well. And I think that that's probably one of the challenges where we will face as a profession too. We need lots of people to be getting on board with it, so that we can then embrace and also create and innovate within the space too.
Yeah, there's lots of great things you can do with AI, but yeah, we just need
Mm,
more nurses to get involved.
mhm.
Great.
Absolutely, yeah.
Lovely. And yeah, my last question then is kind of a tricky one, but where do you think AI might go in the future, which is hard to predict? And yeah, what kind of trends should nurses be looking out for?
Oh, yes. Oh, I love that question. Oh, that's a big one too.
I know,
Uh,
put you on the spot.
One of the areas that we're trying to actually figure this out as well too. So we have just launched a cross-sectional survey with nurses to try and really understand what it is they're using it for professionally and personally and academically as well too. I think we need to try and understand that and figure that out. And then that's going to help us to maybe tailor some more information for our students too and for nurses, so that we're getting that right spot. Um, I think in a research world, what I'm seeing a slight move towards at the moment rapidly is that a lot of the systematic reviews, a lot of the scoping reviews in general terms have been completed. I think people have done things on what is AI in education or what is AI within research, nursing research. They're now getting more specific. I am seeing a lot more scoping reviews around AI in oncology settings or AI in advanced consultation methods, and people are now starting to find their niche and find little bits more of work in there. So I think that that's
Mm.
where we're trending as well. It's certainly not as apparent in nursing as maybe other health professions too. And so I think that there is some really good space for that. And I think then we need to include underrepresented areas of nursing. So again, I would love to see a little bit more within learning disabilities. I'd love to see a little bit more pediatrics, for example, and community care as well. But those are just usually harder to reach, or we don't see as much research. And so I think that that's where we're heading. We're starting to get a little bit more specific, which is great because you're getting some buy-in with that as well too. I really do think that we are going to go in much more tailored precision healthcare. With AI, people are going to absolutely be, we're going to harness the data that exists already. I don't think we need more data. I think we just need to make more sense of it. So we're going to get much more specific healthcare interventions for people, both physically, but then thinking psychologically and socially as well. AI can really help to understand health literacy, improve health literacy for people, and tailored information. You know, we see at times people are given participant information sheets, or we're given handouts or booklets or something like that, but it's one size fits all. Whereas AI can really, in a very rapid way, tailor that to them. And then there's other things as well too that I think are going to be really important, and particularly some of the work that I did in and around social oncology and actually coaching mechanisms and supporting people to self-manage more. I think that's a really, really valid area where we can use AI to help people self-manage with long-term chronic conditions, rather than relying on, again, some traditional paradigms of education or healthcare professional intervention. So I think that that would be a really exciting area to be a part of as well. And again, too, I would encourage nurses to be really part of that. We might not have the tech, but you certainly have the issues that are facing patients.
Yeah, it's great. And it's definitely nurses should be at the forefront of collaborating and coming up with new AI solutions because they've got,
Mhm.
like you said, all of the loads of great clinical insights in different areas that we can help build really good pieces of software for ourselves and our patients. So, thanks so much, Mark. It sounds like there's loads of great things happening in Belfast and beyond. So it's lovely to check in with you, and hopefully we can, yeah, catch up in another maybe 12 months or so and see where you're at with all the projects.
Absolutely. No, thank you so much for the invitation to share with you today,
Great.
and really great to be able to connect with other nurses involved in AI.
Brilliant.